Good afternoon and welcome to PVA's COVID response webinar on the status of VA's SCI system of care. We will begin our webinar momentarily. Once again, good afternoon, everyone. Thank you for joining PVA's COVID-19 response webinar for today's update on the VA's SCI system of care. As our overview of what we will be hearing today, first we have a welcome message from PVA President David Zurfluh, followed by an overview and introduction from Executive Director Carl Blake, to be followed by our main focus of today, which is the presentation by Dr. Manosha Wickramasinghe, who is the Executive Director of VA's SCI system of care. And then we will once again hear from Executive Director Blake to provide a closing message for today's event. As we begin the webinar, we just want to remind you that if you have questions during the presentation, you can use the Q&A control on your screen, and that will post your question. PVA staff will be monitoring the box and responding to questions as we are able, and then gathering any questions specifically for Dr. Wickramasinghe and her team to be provided to her following today's presentation for her review and follow-up. We also want to remind everyone that the webinar today is being recorded, so it will be available to anyone who is unable to participate or for those who have questions about things that they heard and want to follow back up and watch the presentation again. With that, I would like to turn our time over to National President David Zurfluh for his welcome message. President Zurfluh.
Thank you, Heather. Welcome everybody, and welcome everybody that's popping on as I speak. This is a very unique opportunity to have Dr. Wickramasinghe here and give us an opportunity to talk about the COVID-19 situation that we're in. First of all, I hope everybody is safe and sound. And as you go about your daily lives, always be safe, know your surroundings, and make smart decisions. So with that said, again, thank you, everybody. And I will now turn it over to Executive Director Blake, who will tell us a little bit more about our guest, and we'll get on to the proceedings. So Carl, when you're ready, sir.
Thank you, David. I just want to thank everybody first for participating in the webinar today. I think, as you know, we have really over the last couple of months tried to increase our member engagement from the national office level because for us, this is a very high priority because of the potential impact of the coronavirus on our members. We have prioritized ensuring that our members can get the care when they need it and ensure they get appropriate care. Recognizing that there are a lot of challenges that we face right now, but we have tried to stay engaged with our members so that we are aware of any issues, and then we have the benefit of being able to feed that information directly to the VA through the SCI system of care. We've been very fortunate over the years that we have built a very close working relationship with the SCI system leadership in VA, and so with that in mind, we're fortunate to have with us today Dr. Manosha Wickramasinghe, who, as mentioned earlier, is the Executive Director of the VA's Spinal Cord Injury and Disorders Systems of Care at the National Program Office. Prior to Dr. Wickramasinghe's current position, she was the Chief of the VA North Texas Healthcare System, SCI system. She's based out of Dallas currently. She's also served as a research analyst with the Human Genome Project at the Baylor College of Medicine. She completed her training in general surgery at the Sound Shore Medical Center in New York, a residency in physical medicine and rehab at the University of Texas Southwestern Medical Center, and a fellowship in spinal cord injury medicine at the Baylor College of Medicine in Houston. She's licensed to practice in California, Oklahoma, and Texas. and she maintains her board certification by the American Board of Physical Medicine and Rehab with a subspecialty certification in SCI medicine. Dr. Wickramasinghe and her staff have been great partners for the national office, and particularly through our medical services work. She's a strong proponent of the collaborative nature of our relationship. The good thing about our relationship is when we have issues, we know that we have someone and a team that we can go to within VA to get questions answered and get solutions to problems that arise. And it gives us an opportunity to get around some of the typical bureaucratic hurdles that you might otherwise find if you had to go higher up on the ladder and come back down further. So with that, Dr. Wickramasinghe, we really appreciate you joining us today, and I'm going to turn the webinar over to you now. So thank you very much for joining us.
Welcome, everyone, and thank you, Mr. Blake, for the kind introduction. I'm Dr. Minosha Wickramasinghe, the Executive Director of the Department of Veterans Affairs Spinal Cord Injuries and Disorders System of Care. As a physician, educator, and leader who's been blessed throughout my career to serve veterans with spinal cord injuries and disorders, I am passionate in my dedication to making VA the best place in the world to provide care for veterans with SCID. And so I'm most pleased to have the opportunity to join you today and to share about VA's SCID system of care, including our response to the current COVID-19 public health emergency. I'd like to begin by conveying my thoughts and prayers for all veterans and their families who've been affected by the COVID-19 public health emergency, and expressing my most heartfelt wishes for good health and well-being to all of you joining today and for your loved ones. Recognizing the challenges facing our nation during this time, I'm here today to share with you information about the resources available in VA and the SCID system of care, and how we are dedicated to addressing the needs of veterans with SCID in the hospital and in the community. To understand the resources that are available and the system of care that we have today, I would first like to speak briefly about the beginnings of VA's SCID system of care. Prior to World War II, spinal cord injuries were sadly invariably fatal. For example, in the first half of the 20th century, almost everyone died within weeks or months after a spinal cord injury, but that quickly changed, particularly around the time of World War II. Remarkable advances in blood transfusions, antibiotics, and emergency care led to increased survival during and after World War II. Progressively longer lifespans occurred rapidly during the 30 years from the 1940s to the 1970s. Rehabilitation and community reentry programs followed so veterans could resume their family, vocational, and social roles. Whereas spinal cord injuries were fatal before World War II, people started to live long, full lives after World War II. Although it's hard to imagine today, many of the World War II veterans with spinal cord injuries stayed in the hospital for years because their future was uncertain and they were the first spinal cord injury survivors. Nobody knew how long they would live, and the expectation was that their lives would be greatly shortened. So VA and the Department of Defense kept them in the hospital. A small number of hospitals developed early SCI centers so these veterans with spinal cord injuries could live, albeit in an institutional setting. The initial focus of care in these SCI centers was on rehabilitation and physical restoration. Yet, as time went on and it became obvious that their survival would be long, reentry into the family, community, and workforce became the focus. Over the next several years, these VA SCI centers and additional ones in other areas of the country established and expanded interdisciplinary teams of SCID professionals to provide the care that these individuals needed. This led to the system we have today, which provides lifelong health care to veterans with SCID. There are two large SCID systems of care in the United States, VA and the model systems, and many small programs as well. The VA SCID system of care has the largest, most comprehensive system of care in the United States. It provides lifelong resources and care to optimize physical and mental health, educational and vocational opportunities, community reintegration, and resumption of social roles. No other SCID program offers the full array of inpatient, outpatient, and home care services. The VA SCID system of care is unparalleled. It offers primary and specialty care from the time of injury throughout the veteran's lifetime. SCID interdisciplinary teams of experts from many disciplines, including medicine, nursing, occupational, physical and recreation therapies, psychology, social work, nutrition, pharmacy, work with veterans with SCID to improve their lives, outcomes, and quality of life. Care focuses on self-management and healthy behaviors, which are important for veterans with SCID to maintain the best possible health, prevent complications, maintain function, and optimize well-being. The VA SCID system of care provides care from the time of injury through the entire lifespan of each veteran. Comprehensive rehabilitation using state-of-the-science techniques and equipment are provided after the onset of a new SCID. Then, all aspects of healthcare are provided to maintain the best possible health and quality of life while living in the least restrictive environment possible. Unique aspects of this system include the provision of primary and specialty care by trained SCID teams, non-institutional long-term care to support veterans in their homes, the best prosthetics program in the country, which provides veterans what they need to function at their highest capacity, and respite care. Delivering primary and preventative care along with specialized care by trained teams is available in the VA SCID system of care. Highly specialized care is provided for such things as veterans who are on ventilators, have complex wounds, and for veterans with amyotrophic lateral sclerosis, also known as ALS. There are currently 25 SCID centers or hubs across the VA SCID system of care. The hubs are regional SCID centers that offer a full range of comprehensive care provided by large SCID interdisciplinary teams. SCID centers are affiliated with VA facilities within their geographic catchment area that do not have SCID centers. These facilities are known as SCID spokes. They provide smaller SCID teams and focus on primary care closer to the veteran's home. The hub and spokes organizational design provides accessible, high-quality care throughout the country. A study a few years ago found that VA's SCID system of care provided the most comprehensive care as compared with commercial plans, Medicaid, Medicare, the SCI model systems. A unique aspect of the VA SCID system of care is the SCID long-term care program. There are dedicated SCID long-term care beds at 6 SCID centers for institutional extended care for veterans with SCID. 2 additional centers in San Diego and Dallas have additional SCID long-term care units in planning and construction. Although the first commitment is to always try and send veterans with SCID to live in the community, when veterans with SCID need institutional care, these facilities offer high-quality, extended care with a focus on maintaining health and quality of life. Nothing like this exists outside the VA. And surveys of veterans in these facilities, along with analyzing outcomes, have demonstrated excellent outcomes in these facilities. Now that we've discussed the VA SCID system of care, let's turn our attention to the COVID-19 pandemic. I'll first discuss general aspects and then review what we have done in the SCID system of care about the current situation. VA has worked tirelessly in response to COVID-19. The protection of veterans and VA staff is and always has been VA's #1 priority. As with previous natural disasters, VA has responded quickly and is doing everything possible to look after the needs of veterans by putting into place a forceful and dynamic public health response to prevent and, when needed to treat, health risks posed by COVID-19. COVID-19 emergency preparedness exercises began weeks before the first case was confirmed in the U.S. VA's Emergency Management Coordination Cell, EMCC, was activated immediately after the first case was verified in January earlier this year. Drawing from a broad range of emergency management and expertise throughout the department, the EMCC monitors and translates the Centers for Disease Control and Prevention guidance. The CDC is the nation's health protection agency working around the clock to protect America from health and safety threats. CDC increases the health security of our nation. The guidance provided by the CDC for VA's operational environment has been used throughout the years to prepare, train, and educate VA staff and enhance our overall response plan. We are here for every veteran that needs help during this health crisis. There are many resources for you, including web pages on VA's internet site, I encourage you to check out the VA's coronavirus webpage located on VA's internet site. The URL for this website is here on this slide. There's a wealth of information for you and your families, including veteran-focused list of frequently asked questions. During this time, VA is protecting those veterans and staff who receive care, visit, or work at a VA facility. With that, protective measures have been established across the system. For example, veterans who have symptoms of a possible COVID-19 infection, such as cough, shortness of breath, or fever, are asked to call ahead before going into a clinic, urgent care center, or emergency room. Calling first helps us to protect you, other veterans, medical staff, and other patients in the hospital. VA has also implemented 2 zones of care within inpatient units, one for dedicated staff and patients with COVID-19, the other zone for all other care. As another strategy, VA has shifted a significant amount of outpatient and home care to telehealth interactions. Elective and non-emergent procedures have been canceled. These strategies reduce the risk of exposure and transmission of the virus for veterans and staff. Using dedicated staff and space to care for COVID-19 patients while inpatients and leveraging technology to use telehealth for visits that can be performed with virtual care is central to our strategy to protect you and our staff from COVID-19 infections within VA. Having discussed the shift of non-urgent problems to telehealth and other virtual care, many questions have been raised. I want to thank Mr. Zurfluh, PVA National President, for one such question. He asks, how will routine appointments, particularly annual evaluations and respite care, be scheduled once access limitations for routine care are lifted? I anticipate that face-to-face routine appointments will continue to be delayed for some time due to the significant risks of COVID-19 exposure, which includes the time when communities are reopening. I encourage veterans needing an annual evaluation, or if you have other needs, engage with your SCI team who can assist with most things, such as completing most portions of your annual evaluation via telehealth or other types of virtual care options during the COVID-19 pandemic. Then, at a future date, as yet undetermined, as routine care is reinstated, each SCID center will work with you to reschedule face-to-face annual evaluations, respite care, and other routine care. VA is following CDC recommendations and other experts on how to protect veterans and staff. VA medical facilities are screening patients and visitors for symptoms and restricting facility access based on the results. Screening questions are asked such as, do you have a fever, cough, or shortness of breath? During the screening process, anyone with suspected COVID-19 will be masked and moved into isolation. This is in alignment with CDC recommendations that surgical masks and N95 respirators be reserved for healthcare workers, other medical first responders, and patients diagnosed with or suspected of having COVID-19. The facility supply levels of personal protective equipment, such as N95 respirators, surgical masks, gowns, face shields, and gloves, are being monitored and reported nationally. When necessary, supplies and equipment are redistributed rapidly to areas that need them. It is important to emphasize that prevention is the best medicine. Veterans, you, and staff are strongly encouraged to take the everyday preventive actions recommended by CDC to avoid exposure to COVID-19. Remember that the CDC recommends that you and your family wear cloth face coverings while out in public settings and maintain social distancing of at least 6 feet between other people whenever possible. Many questions have been raised about personal protective equipment. One of the questions from a PVA member asks, why isn't VA providing personal protective equipment for SCID veterans and their caregivers? This has proven to be an extremely complex question throughout the country and the world. VA remains committed to provide personal protective equipment to veterans and staff and continues to allocate resources to provide recommended medical supplies. There has been a concerted effort, and monitoring will continue to identify sites which require an increase in the supply level and provide appropriate resourcing of medical supplies. For veterans with SCID at home, There have been recent efforts to identify any shortages, and our office is working with others in VA to ensure that veterans with SCID receive supplies that they need for self-care. Also, in following CDC guidance, VA healthcare providers decide to test COVID-19 in veterans based on many factors, such as the severity of symptoms, other existing illnesses or conditions, and possible exposure to the virus. VA does not charge for testing. One important note about testing: VA is testing all veteran inpatients in SCID centers and community living centers, as well as all staff for COVID-19 on these units. These highly vulnerable groups of inpatients and residents are at the highest risk for developing complications from COVID-19, so VA is monitoring the situation very closely. VA posts the results of testing on the internet at www.va.gov/coronavirus. By posting this information, we are providing information to you and other veterans so you can make the best decisions about your own health care. Although this information changes quickly, it offers veterans and the public an opportunity to see how VA is responding to COVID-19. Many questions have been raised about testing. A PVA member asked the question, since VA SCID patients are very at risk, why aren't there procedures, provisions for us to get virus testing prior to symptoms, as well as the testing for our caretakers and spouses? Let me share with you all that VA recognizes that veterans with SCID are a vulnerable population at high risk for complications from COVID-19. And with that premise, VA has implemented several interventions to help prevent exposure to and identify infections from COVID-19. For example, policies and practices have been instituted in SCID center inpatient units to minimize risk, including COVID-19 testing of inpatients and staff. If you have any questions about testing, please contact your provider and discuss your concerns. VA is quickly adapting our care practices and policies to ensure veterans have access to their provider and to reduce potential exposure to COVID-19. Changes that impact SCID centers and VA community centers include such things as admission policies and visitors to inpatient units. In SCID centers, admissions are currently restricted to veterans with SCID that have new injuries or are sick and in need of inpatient care. The policy for visitors to inpatients on SCID center units has changed and is now restricted to avoid exposure to possible COVID-19 infection. There are some exceptions to this visitor policy, such as when a veteran is in a hospice setting and in the last stages of life, but for the most part, visitors are restricted now. There are similar policies that restrict admissions and visitors in VA's community living centers as well. VA released its COVID-19 response plan on March 27, 2020, making it available to veterans, other stakeholders, and the general public. This allows medical providers across the country to review, learn from, and provide feedback on our plan as we all work to combat COVID-19. The plan can be found at the location noted on the slide. Every day, we use our prior experience with pandemic influenza, severe acute respiratory syndrome, or SARS, and Ebola to more effectively respond to COVID-19. To ensure we are prepared to respond at every level of department, each VA medical center has a comprehensive emergency plan that has been updated for the current crisis. Just as we assisted with the recovery in Puerto Rico after Hurricane Maria in 2017, we've also joined with other government agencies through the Disaster Emergency Medical Personnel System, or called DEMPS, to provide staff and expertise to the front lines. VA has a world-class medical and emergency response team, and these teams are doing incredible work on the front lines of this fight. Mentioning the visitor policy raises a very important question. My thanks to this question from a PVA member who asked, how will the visitor policy for SCID centers evolve in the coming months with the lifting of stay-at-home orders? As communities are reopened and stay-at-home orders are lifted, there will most likely be increased spread of COVID-19 and ongoing risk of COVID-19 infection. Therefore, the visitor policy for SCID centers will remain restricted until it is determined that the risk of exposure to and infection from COVID-19 is acceptable. Veterans with SCID and SCID centers as inpatients are at particularly high risk for adverse outcomes from COVID-19, so we all need to continue to do our part to protect them. So I can't give you an exact time or anticipate how the visitor policy will change. We need to continue evaluating the situation and risks and do what is safe for the inpatients at our SCID centers. We recognize that this is very stressful. Taking care of your mental health is essential during this time. VA continues to support mental health services for veterans. For you who might feel anxious or overwhelmed by the COVID-19 pandemic, I know we are all feeling anxious and overwhelmed. You are not alone. Veterans and their family members can connect with support through in-person appointments at local VA facilities, telehealth sessions, and online resources. Please remember that you can change existing mental health appointments to telehealth, phone, or video appointments by calling your provider or sending a secure message through My Healthy Vet. You can also ask for a new mental health appointment. If you need same-day mental health care or want to request a new appointment, call your local VA healthcare facility. VA has tips for maintaining and enhancing your mental health during the COVID-19 outbreak and more information can be found at the URL on your screen. VA has developed several mobile applications to promote good self-care. Here are 3 examples. The Annie app uses automated text messaging and helps veterans take a more active role in their health by following a personal care plan set up to address many health conditions. A new Annie protocol is specifically focused on COVID-19 symptoms. The COVID Coach app was created for everyone, including veterans and service members, to support self-care and overall mental health during the coronavirus pandemic. PTSD Coach is a free and publicly available mobile app for people with post-traumatic stress disorder and those interested in learning more about PTSD. Together with professional medical treatment, PTSD Coach provides you with resources you can trust. Although there have been dramatic changes in healthcare as a result of the COVID-19 pandemic, the VA SCID system of care remains available to serve you. To protect the health of veterans with SCID who are well, routine face-to-face visits have been converted to virtual care whenever possible. I encourage veterans to stay engaged with your VA SCID team, whether in a center or a spoke. I strongly believe that you will get the best possible care within the VA SCID system of care, but we also recognize that these are extraordinary circumstances, and if care within VA is not possible, community care is an option. During the pandemic, VA will make community care referrals when needed. We're currently prioritizing referrals for urgent or other medically necessary care due to COVID-19. Please remember that some community care providers may be affected by closures, limited services, quarantining, or social distancing based on CDC and local health department guidelines. Veterans should call ahead to confirm an appointment and work with their community care provider to reschedule any canceled appointments. Knowing the extensive impacts on the community health system, VA is extending authorizations for community care referrals. You, our veterans, should continue to work with their community care provider to have your needs met. Community care eligibility requirements have not changed. Appointments to see community care providers still need to be approved by VA, except for emergency and urgent care needs, and getting a referral depends on eligibility, type of care, and other factors. I definitely recommend you check out the VA community care website noted on this slide as well. VA is creating new and innovative strategies constantly to support veterans during the COVID-19 response. For example, VA has moved aggressively to ensure each of its 170 hospitals and more than 1,200 clinics are staffed to handle the increasing flow of patients due to COVID-19. Under new hiring authorities from the Office of Personnel Management, VA HR has revamped processes to speed up the hiring and onboarding of VA staff. Since March 29th, VA has hired nearly 9,000 new employees. Although not specifically designated to the SCID system of care, the new staff are supporting the overall VA mission. In addition to all we're doing to serve and protect our nation's veterans, VA stands ready to support the department's fourth mission, to bridge the gap in civilian health care during times like these. Request for VA's assistance comes from the Department of Health and Human Services. VA is monitoring carefully the COVID-19 spread in several different cities and states in order to prepare for outbreaks and to reinforce areas where the civilian health care system is stressed. VA is also carefully monitoring and coordinating veterans' needs during this time to ensure resources are available. VA has activated the DEMS system to offer surge support in some of the hardest hit areas of the pandemic. That's the Disaster Emergency Medical Personnel System that I mentioned a few minutes ago, and surge support, for example, in cities such as New York City and New Orleans have been activated. In all, VA has accepted multiple fourth mission requests, ranging from requests for additional staff, beds, and equipment. VA will continue to monitor capacity to support our communities while ensuring that veterans receive the care they need. We are proud to serve the nation and our veterans during this time of crisis. I would like to now turn my attention to our SCID system of care to let you know what we are doing during the COVID-19 public health emergency. VA's SCID system of care has been and continues to be singularly focused on the health and safety of veterans with SCID and our employees. We recognize that many of you listening to this broadcast are at high risk for complications affected by COVID-19. Therefore, we are doing everything possible to provide information and resources to you. My office continues to provide guidance to VA facilities and SCID clinicians intended to mitigate exposure to and transmission of COVID-19 and ensure continued access to care, primarily through an expansion of telehealth and other virtual care services. And that raises some very important questions. Thanks to Mr. Blake, PVA Executive Director, for this two-part question. The first part asks, as stay-at-home orders are lifted around the country, what would you like to make sure SCID veterans know about protecting themselves from potential exposure to the virus? Let me start by saying, as we address the priorities and needs associated with the current conditions in this public health emergency, VA is actively considering and planning next steps. I think there is universal agreement that as communities are reopened and stay-at-home orders are lifted, there will be an increased spread of COVID-19 and ongoing risks of COVID-19 infection. Since people with spinal cord injuries and disorders are a highly vulnerable group to develop complications and or even die from respiratory infections, I would like to make sure that you and all veterans with SCID take all precautions to avoid exposure to and infection from the COVID-19 virus. Even though communities will reopen, I would still encourage you to largely stay at home and continue to use virtual care whenever possible until we have a better understanding of new risks and transmission in local communities. To answer the second part of this question, how should veterans re-engage with the SCID system of care? I would say that although there have been dramatic changes in healthcare as a result of the COVID-19 pandemic, the VA SCID system of care remains available to serve you. Let me just repeat that. The VA SCID system of care remains available to serve our nation's heroes, you. To protect the health of veterans with SCID who are well, routine face-to-face visits have been converted to virtual care whenever possible. This should continue until risks of exposure to COVID-19 in the community and in the hospital are much lower. I highly encourage you to stay engaged with your SCID teams, whether in an SCID center or a spoke. Building upon a framework established by senior leaders that addresses all veterans receiving VA care, my office has crafted guidance for the SCID system of care specific to the specialized needs of veterans with SCID. Initial guidance was released on March 6th, then we provided expanded guidance on April 7th. The information shared is multifaceted, encompassing specifications for inpatient, outpatient, home care, and virtual care. Broadly, it addresses actions to prioritize SCID inpatient capacity to treat patients with acute injuries and illnesses that require inpatient care. It focuses on reducing the potential for COVID-19 exposure to inpatients and staff on SCID units. It further focuses on supporting the wellness of our veterans in the community, notably through the expanded use of virtual care modalities, including telephone care, telehealth, and secure messaging in My Healthy Wet, as well as outreach and screening. There have been many questions related to guidance for where to go and what reassurances that care will be of high quality. A recent question from a PVA member asked, if a veteran has to go to a VA spoke due to COVID-19, how will he or she be assured that the spoke will be able to properly handle SCID care, especially pressure sore prevention? I'd like to take this opportunity to assure everyone that the VA is open and we are here for you. If you have a health concern, please don't hesitate to contact your provider. Your health and safety are our top priority. I strongly believe that the best care available during the COVID-19 pandemic is in the SCID system of care, and I encourage you to engage, again, with your center and or your spoke team. With regards to your very important question about pressure sore prevention, pressure injury is a very real concern with any hospitalization and illness. Most spokes have SCID teams that have expertise to guide SCID care and help with decisions such as specialized support services to prevent the development of pressure injuries. SCID centers are also available for consultation and or telehealth with each of their affiliated spoke facilities. So if you have symptoms of fever, cough, and shortness of breath, call your VA medical center or the closest SCID center before going to a clinic, urgent care center, or emergency room. Calling first helps us protect you, our staff, and our patients. Demonstrating the creativity, ingenuity, and teamwork within the SCID system of care and our colleagues across the VA, my office led the development of a SCID-specific evaluation template that enables SCID staff to screen all veterans with SCID for COVID-19 and provide outreach in the same conversation, all while you are at home. For each of us, there is no more important time than during this COVID-19 pandemic to take charge of our health and make sure that we take care of all aspects of our mental and physical health and well-being. Whole health, also known as personalized, proactive, patient-driven care, is an approach to healthcare that empowers and equips people to take charge of their health and well-being and to live their lives to the fullest. Prior to the COVID-19 outbreak, the SCID system of care, my office, partnered with the Office of Patient-Centered Care and Cultural Transformation to lead and support SCID centers as they adapt and implement components of the whole health model. Today, it is vitally important to continue these efforts. The whole health model is well aligned with the SCID system of care's existing commitment to patient-centered care, and at all times, particularly during the COVID-19 public health emergency, it is important for you, your family, your caregivers, our employees, and our communities to remain committed to all aspects of health and well-being, as depicted in the Circle of Health. I encourage you to visit VA's Whole Health webpage, available at the link on this page, to learn more about the whole health approach to care and resources that may be available, including VA's ongoing self-care blog series. A very important question came from a PVA member recently on the whole health issue. The question was, what will be done to encourage, motivate, award, and promote both physical and mental fitness to our membership during this time of social distancing? I wish to emphasize that maintaining good physical and mental health is extraordinarily important at this time. Most people in the country are feeling stressed and anxious by the COVID-19 pandemic. There are many uncertainties. So I cannot state this strongly enough. Please take care of yourself and your family. VA and the SCID system of care remain committed to this issue and focused on enhancing the whole health and well-being of you. Throughout the COVID-19 pandemic, several innovative activities and ideas have been put into place using telehealth and apps to reach veterans with SCID in their homes. Some examples of these innovative ideas include health education, whole health, self-care techniques, home recreation programs, and several apps, including Mood Coach and the app that I mentioned earlier called the COVID Coach, which were created to provide resources and enhance emotional support. In addition, many members of our SCID interdisciplinary team at our centers have reached out to support you in their homes, in your homes, including providers, nurses, occupational and physical therapists, psychologists, social workers, dietitians, pharmacists, recreation therapies. Everyone is reaching out. With a focus on wellness and prevention, all of these interventions have promoted health, physical, and mental wellness during these challenging times. Recognizing the immense value of sharing information with you, your family, and caregivers, my office is making a concerted effort to add SCID-related content to our veteran and caregiver-focused internet site, available at www.sci.va.gov. The internet site is our public-facing site that includes information regarding VA's approach and response to the COVID-19 national public health emergency and features information for veterans with SCID, as well as material on virtual care options and CDC guidance. While I encourage you all to contact your VA SCID healthcare team for assistance and to have your questions answered, the internet also includes a contact link that can be used if you're unable to reach someone within your local VA SCID healthcare team. So please check out this website. Since the start of the COVID-19 crisis, healthcare providers all over the world have been scrambling to get set up to deliver care using telehealth. For the VA, though, ramping up the use of telehealth has gone relatively smoothly because we already had the infrastructure in place to do so. The VA has been using telehealth for decades and in the past 10 years has developed a robust infrastructure to deliver virtual care from one VA site to another and directly to veterans in their home. In the past month alone, more than 360,000 healthcare visits were conducted using VA Video Connect, the VA's platform for connecting with veterans in their home using a computer or mobile device. In response to social distancing recommendations, the VA SCID system of care continues to adapt our ability to deliver care by leveraging multiple advanced virtual care options so that you can stay connected with your healthcare team from home. Because we recognize the advantages of telehealth for veterans with SCID, the majority of our SCID centers have a dedicated SCID telehealth coordinator to support both staff and you in the use of telehealth. This effort is also supported from my office, where I have a program lead dedicated to the implementation and expansion of telehealth programs throughout the SCID system of care. In these next few slides, I'll share some of the tools that you can take advantage of. VA Video Connect, sometimes called VVC, is a solution that enables you to meet with your VA healthcare provider over live video in a virtual medical room from just about anywhere. This allows you to receive care from home and reduces travel time and inconvenience. VVC uses encrypted video to ensure the session is secure and private, so it's more secure than applications such as FaceTime or Zoom. The process to get connected is simple and straightforward. An appointment can be pre-scheduled in advance or set up on demand at a moment's notice if needed. The veteran, you, receive an email with a link. When clicking this link, it brings you into the virtual medical room and the visit takes place. VVC visits can be completed by you using your own computer, smartphone, or tablet. If you do not have a device, the VA may be able to provide a loaner iPad with an included data plan free of charge. With the recent surge in the use of telehealth, VA has been working closely with Apple to make sure that enough iPads are available for those who need them. For veterans who may have difficulty managing the use of an iPad, we have worked with VA telehealth services to take advantage of the many accessibility features of the Apple iOS, and we can customize the configuration of the iPad to meet an individual's needs. Contact your healthcare team to get started using VVC, please, and to learn more about the iPad loan program. It's an invaluable tool in your toolkit. I'd like to take a moment to share with you a video that features the perspective and experience of veterans with SCID and employees who use VVC.
I served during the Vietnam era in the Army and was injured in a motorcycle accident 17 years ago. I feel comfortable at the SCI clinic. They know my needs a whole lot better than everybody else does, so I've continued to go to Dallas, and that be my primary, but it's 80 miles.
Well, I'm a C5, C6 quadriplegic. I was in the Army from 1980 to 83. It wasn't long after I got out of the Army that I ended up getting into an automobile accident and broke my neck. The number one thing I like about telehealth is not having to drive to the VA.
So when we do telehealth, they're in a more relaxed state, they're at their own house, they have their medications right there, so if I have a specific question they don't remember, they can literally look at the bottle and see, exactly what they're taking and tell me exactly what they're taking.
Good morning, how are you doing today?
I'm fine, and you?
Pretty good.
I mainly see patients when they come in to the Spinal Cord Injury Center for their annual exams, and so on that day they see everyone. They see their physician, they see psychology, social work, PT, OT, so it's a hectic day, and so sometimes, squeezing in pharmacy is a little bit difficult, but by doing CBT, I see them beforehand, and then I'm able to go through all their medications and also help triage any kind of major concerns they have.
Still taking the Atodolac, doing 1 tablet twice a day as needed for pain?
Yes.
Still taking the low-dose aspirin every day?
Yes, ma'am. This way I can spend 30 minutes on telehealth and have the answers that I need and the consults, and we just connect, and it's like I'm right there.
Are you able to position your camera up a little bit more so I can see your face?
Sure.
One of the biggest things is convenient, right? It's convenient not just from the provider's perspective, but from the veteran's perspective as well, because within less than 5 minutes we can hop on and we can connect, and whatever the patient's issues are, we can usually deal with them in a very efficient and effective, timely manner.
I see here that you are taking Laxatine and gabapentin for your pain. Is that correct?
Kind of depends. In the morning are my better times.
Okay. Do you use any mindfulness?
I do. In fact, I went through the course, and I did that via teleconference as well. I mean, it's brutal when I'm taking the drive, and I'd much rather drive into my office than having to drive all the way down into Dallas to go to see my doctors.
How many capsules a day are you taking?
Just one.
Just one once a day?
Yes. I'm seeing my same physicians and nurses that I would if I had to drive to Dallas. I just don't have to spend all day driving to Dallas and back.
It's so convenient. You can use your computer, tablet, or phone, and instead of driving all the way down into Dallas, you can just go see your provider in your fuzzy slippers.
As we saw in the video, veterans with SCID and employees share in their views of the benefits and convenience of VVC to the home. One concern that you may have when using video on your personal mobile devices is that it uses up their data plan. And because many folks do not have unlimited wireless data plans, I'm pleased to share that VA has partnered with a number of national wireless carriers, including Verizon, Sprint, T-Mobile, and TracFone on the T-Mobile network to provide VVC services to veterans without any charge against your data plans. On these networks, a veteran can use VBC on an unlimited basis without using any of their data plan minutes. As I mentioned earlier, the use of VBC has really grown with the COVID-19 emergency declaration, as you can see from this chart. During April, over 4,600 VBC visits were conducted between providers and veterans with SCID. In addition to telehealth video visits, another very useful tool for you to stay connected with your healthcare team is My Healthy Vet. Using this online portal, you can conveniently order prescription refills, schedule appointments, view your medical record, and send secure messages to your healthcare team, all from home. Secure messages sent through My Healthy Vet are totally secure and allow you and providers to communicate about non-urgent matters, discuss treatment adjustments, medication changes, and more. I encourage all of you to set up a premium account at www.myhealth.va.gov if you don't already have one. There is, of course, no cost to use this platform, and it is easy to get started. I wanted to also share that I meet weekly with all the SCID Center leadership teams to review all guidance and communications related to COVID-19 and our system of care. This platform allows us to share the latest information as well as an opportunity for open dialogue between SCID centers and the National Program Office and my team. In addition, VA has a strong relationship with PVA. Communication and collaboration are extremely important during the COVID-19 pandemic. Each week, my SCID National Program Office team and I meet with National PVA leadership to share the latest status updates and guidance as it relates to COVID-19 and the SCID system of care. We also use that time to respond to any questions that PVA leadership may have regarding COVID-19 and SCID veteran care. It is a close collaboration, and we plan to continue this for a very long time to come. In looking to the future, we all look forward to the time when there is an effective vaccine for COVID-19. A PVA member asked a question about if or when a preventative vaccine or antibody vaccine is developed, do you anticipate VA getting early and sufficient doses and the VA SCID veterans prioritized for the vaccinations? Not since the polio epidemics in the mid-20th century has there been such acute awareness of a need for a vaccine. Better days will come when a vaccine is available. At this point, I'm not aware of discussions about the VA getting early doses of a future FDA-approved COVID-19 vaccine. We will continue to seek guidance from VA leadership and, as with other respiratory vaccines such as influenza and pneumococcal vaccinations, I will advocate for prioritizing veterans with SCID as they and you are at a high risk of complications or death from respiratory diseases. Notably, our past work and advocacy resulted in the prioritization of veterans with SCID for the influenza vaccine, contributing to significant increases in the rate of vaccinations for our veterans. In a similar manner, I will strongly advocate for prioritizing veterans with SCID to receive a future FDA-approved COVID-19 vaccine once it's developed. I know that I've shared a large amount of information today, but I hope that the information I've shared answers many of your questions about the care VA offers for you to all veterans with SCID and what the VA and our system of care has been doing in response to COVID-19. I want to thank again Mr. Blake and the rest of the PVA leadership team for inviting me to participate in this webinar today. Thank you very much.
Okay, thank you very much, Dr. Wickramasinghe. We certainly appreciate you spending some time with our members today. I want to thank the members who were asking questions throughout. Hopefully you got some answers to the questions that you shared. What I would recommend is if you have any follow-up questions, please feel free to contact myself or Sean Castle, our Deputy Executive Director, our medical services team based in our national office in Washington, D.C., or you can work through our national service officers at your local levels. If you experience any unique challenges, please reach out to us because we have an outlet and a forum with Dr. Wickramasinghe and her staff on a weekly basis, it gives us an opportunity to bring even unique situations to them to think about and consider how to address. So Dr. Wickramasinghe, again, we appreciate you joining us today. For all of our members who are on here, I would encourage you, if you have not done so already, to please visit our COVID response page that's found on the PVA website. That can be found at www.pva.org/COVID-19. Again, that response page is www.pva.org/COVID-19. You'll find on there a lot of information from broader information that has been provided to us from CDC and WHO and organizations that are out there, as well as more member-specific information that we have compiled from our own staff that addresses unique needs and experiences of our members, veterans with spinal cord injury and disease. The last thing I would ask you to do is we sent out widely on Monday our latest member survey. We've done a number of these now. Each one evolves as we learn a little more throughout this pandemic process. So if you have not done so, you should see on the webinar right now a link to that. We've also distributed the information through our chapters and their leadership, through our social media pages, and through our member e-newsletter that we reach out to contact our members. So please go and take that survey. It is vitally important because it informs our activities in the national office, and it also helps inform input that we provide to Dr. Wickramasinghe and her staff. And again, the last thing I would remind you is if you have any issue, please do not hesitate to reach out to us at the national office, which includes reaching out to one of our national service officers in your local areas. So again, we thank you all for joining us today, and stand by and look for our next opportunity to do this here in the near future. So I would ask everybody to please stay healthy and stay safe, and we'll talk to you all soon. Thank you very much.
This concludes today's webinar. Thank you.